I think we're going to have a real treat. India's journey with ROP from Professor Azad. So we look forward to his talk. Sir.
Good. So basically, you know, what I'm going to tell you in this presentation is, kind of maybe, it may be my journey, you know, to retinopathy of prematurity. And it also will be the journey of India, and it also will be my journey on the global platform. So that is what it is. This is an oft-repeated slide. And where you can see that South Asia, it harbors 32.5% of total blind people in the world. And the prematurity in India, when we consider in the the landscape of global prematurity, it is almost approximately 25 to 30%, maybe little, because it's here mentioned here less. And the ROP blindness is also a good number in our country, which is 15%. What are the challenges we have in front of us? Our challenges are the effective early detection and treatment, and which means effective screening. The next challenge is about the awareness. We often talk, I think in the previous talk also, previous session also you must have heard. And then there is a lack of trained manpower. And Subhadra has gone, she is the one, who is involved in, good number of trained people all over the country. Of course, I am also one of them. But I give credit to Subhadra, because she is Jhansi ki Rani for our retinopathy of prematurity. She is coming there. So these are the three challenges in front of us. First is the lack of screening. This is just a data to give you impression that how much important is screening. This is a study we did in RP Center where Parijat was also, Parijat was with me, and he used to, take all the brunts of my patients and also the work and all this. So you can see here that 32.48% were both high stage 5. Both high stage 5 means you are blind, totally blind. And the mean PCA was 7 months after, the birth. And the delay was 6 months. Like after 6 months, these babies and the parents, they report to you. And the common risk factor was oxygen therapy, which was 80, almost 90%. So this is something which is very, important. And out of this, again, another 90% where babies were not screened. So that is the problem of screening, the challenge of screening. The next was awareness. We also looked into it, and we found that 86% of babies which were referred to RP center or a big tertiary care center, they were referred by ophthalmologist, 8.7% by pediatrician, correct diagnosis by 4.3% ophthalmologist. Of course, this is, 2016 and now 2024. So a big, gap of years are there. But nevertheless, we still have a problem of correct diagnosis. And then metropolitan city like Delhi, it shared 30%. It's something very startling. And 90.3% of these babies were blind. So we have talked about screening, we have talked about the awareness, and this is a public health problem in the developing world. An ROP child will remain for 60 years blind for 60 years. We talk about the cataract blindness. Cataract blindness, normally people are above 60 years. Here we have a baby born with blindness, which is much more devastating, not only for the person, for the baby, for the entire family, and for the entire nation. I have just this, a very, what you call as a modest workout, maintenance costs 2,000 per month and 4,000 rupees altogether with productivity. And this will amount to 28.8 lakhs, which is 37.600 US dollars. And the average cost of treatment is only 15,000, maybe this side, that way, a little bit more, little bit less. So this gives the impression that, treating the baby, bringing them out of blindness is a very small amount as compared to the burden which will be faced by the society, by the family, and by the nation is too big. Now, I'll talk about our country, what was the neonatal situation, and it was limited to major cities and only few ophthalmologists. I should not say 2 to 3 ophthalmologists. I wanted to correct it, but I couldn't. And a few ophthalmologists, maybe 3, maybe 30, whatever it is, and Center of Excellence for ROP developed in RP Center, PGI, LV Prasad, Shankar Netralaya, and many other places. And screening started to expand. And then what came to my mind was that we should have an awareness workshop, because screening, awareness, and a public health problem, these were the 3 main issues. And so we, started a unique concept of having a paired workshop where the ophthalmologist and neonatologist will also be there. The basic reason was that neonatologist or a pediatrician, he sends ophthalmologist these babies, and I always say this is a gift from the neonatologist or pediatrician to us. So we should treat the gift very well. So we did this workshop. Another unique thing we did was we did an assessment, what the impact of this workshop on the audience or on the participants, and we found it was highly significant. We had this workshop earlier with the Government of India and WHO. I think I went to many places like Mysore, I went to Patna, I went to Lucknow, I went to Bhopal, I went to Delhi, and many other places we went. I think in Hyderabad, Subhadra, maybe in 1999. So we did all this workshop, and a lot of people, got aware, not only ophthalmologists, but other people also. And then Sightsaver, they got interested, and they, took part in propagating this, message of retinopathy of prematurity. These are the places where we went 2008 to 2012. Pune, Lucknow, Mumbai, and all this mentioned here, I did not tell you. And this trained 650, I'm saying, but maybe much more, maybe around 1,000 people were trained. After 2012, the Government of India started these SNCUs and level 2 SNCUs to address the neonatal mortality. Mortality rate has come down. I think, how much is mortality rate, Subhadra, now? I think, yes, 12 to that, but 13%. It used to 70%. So basically, neonatal mortality is related to retinopathy of prematurity. So the 1,000 were planned SNCUs, and however, now most of the SNCUs are in place. And ROP was included as one of the 30 conditions of children in the RBSK Child Health Program. Means Rashtriya Bal Suraksha Karyakram is the RBSK. And the Government of India initiative took in preparing a national task force. Of course, I was advisor to Government of India at that time for blindness program, and I specifically said that ROP should be there in the national task force should be made, and we prepared the task force. And all people who are sitting here were in the part of the workshop and part of the this technical group, expert group, basically for preparing a guideline for program implementation, competency-based training curriculum, monitoring and evaluation, and advocacy and communication and program monitoring. These were the few aspects which we entrusted to the National Task Force on Retinopathy of Prematurity. In between, the Queen Elizabeth Trust came in and they said that we want to support this program. Okay. So Trust supported this program, and Trust, they, did a bi-pronged approach. Means they took neonatal care mentoring institutions, and they also took into account the eye care institution centers, basically for training in ROP screening, and neonatal care for quality improvement for neonatal teams. Basically, ROP, one side is the prevention, and the other side is the management or the treatment. The prevention will more come from the neonatal side, and that's why the Trust program, they took both the aspects into consideration, and these district SNCUs, they were linked to the medical college. So that was the concept with which the Trust helped us. And then the program is still going on. Lots of other things are coming. This is very important, National Committee and Guidelines. Then I did Asia ROP Survey 1. I am not showing the details of that, but I'm just telling you that countries where national committees were formed, or where the national program had included retinopathy of prematurity in their program, there the ROP prevention and ROP blindness has come down considerably. And these are the countries, national guidelines, almost all countries. Now the Bangladesh also has a national guideline. Subhadra, I think Subhadra was there who possibly released the program. I don't remember. So basically, those countries which people have now, their own guidelines are there. Now, I try to augment this ROP education on global platform. We had, rather going into this, we had first ROP, and International ROP Prematurity was held in Vilnius, Lithuania from September 14, 16, 2006. 260 participants from over 50 countries. Rasa Bagodini and Rasa Sirutini, perhaps these are sisters, if I'm correct. So there are special efforts of these two Lithuanian ophthalmologists, and they, organized the first meeting of retinopathy of prematurity. Second ROP meeting, I was, fortunate to organize in Delhi. It was a big, the MF Chang, who is now the director of NEI, he was also there in that meeting. And many other people, Wai Chi Wu was there, and many other people were there, yes, Mike Tracy was also there. I, invited him, and he was there, so kind of him to come. And it was a, big meeting. And these are the pictures, maybe Subhadra maybe somewhere here, and maybe Karobi maybe. Parijat, of course, has to be there. Mangat Dogra will be there, and Anand will also be there. So third international conference was organized in Shanghai. And Shanghai was the place, where Pekin Chow, he is there in that hospital, and he is a good friend of mine, although he says he is my, student or mentee, but whatever it is. So he was there, he organized this meeting, and wonderful meeting was there. And this is the picture, this is Pekin Chow, and this is the group, the audience which is there. And the fourth international meeting was held in Cancun, where I was there, and many other people, Subhadra was there, Anand and Dr. Dogra. And here we had breakfast with experts, workshops, presentation, posters, free works, and discussion, and panels were presented. And Marilyn Miller. Marilyn Miller is alive, Subhadra? I don't think. So she was very kind, even in our meeting in Delhi, she had given some travel grants to us, which we had given to at least 5-6 people, young people. We had given travel grants in Delhi when we had organized. And Marilyn Miller, I think she was not there, but she was there. She's mentioned, yeah, she was there. And banker, our banker, no, his name is banker, but he is not our banker actually. I want him to be our banker so that society grows well,
I'm a banker for my program.
Anyway, so this is the Fourth World Congress in Cancun, Mexico. It's a beautiful place, Cancun. If you have not gone, you can go there. And of course, you can enjoy the beauty of the sea beaches. Our hotel was on the sea beach. and many other good things are there. Another thing is there, the culture of, Mexico is very much similar to ours. There's a Mayan culture, Mayan culture. Mayan culture and our culture, वहाँ भूत प्रेत का वहाँ भी है. There is a place where Bhoot Pret Center is there. And like that, those things are there, which aligns our culture to the Mayan culture. And the Fifth World Congress, very recently we had in Dubai. And Dubai, of course, everybody wants to go there. And we had a good meeting there in a short notice. And we could have so many people. We discussed so many things. So many new things came. And that was the place where we found the World ROP Council. And this is the charter which was signed there. And the next meeting of World ROP we are going to have in Italy mein jagah. Florence. So we are going to have this meeting in Florence this year or next year? This year. So we will give you send you the announcement and the information. And of course, Florence, I have been there. It's a beautiful place. And of course, that is there. So this is World ROP Council. And then we come to our own, this IROP. As I said, this is a family. We are having a consensus meeting at 3 o'clock. And we meet every year. And we had a first meeting in Bangalore. And courtesy Anand Vinekar, because he's very kind and he organized the whole meeting. I think, of course, how many people were there? 30 people? 38. And how many people are we now? 223. So you can, multiply how many times from 30 to 200. Kitna bar hua? Anyway, first meeting in Bangalore, second in Pune, third meeting in Raipur, fourth meeting. Pune meeting was organized in HV Desai Hospital. And I remember first time, I took my video indirect. And with video indirect, I showed them the ROP, the area on the screen. That was first time it happened, and people were very happy. And since then, a very good ROP program is now being done in HV Desai Hospital in Pune. And then Raipur is Anil Gangwe's place. And that meeting was also very good because that's a very organized, center. And with Anil Gangwe there, he is also dedicated like Anand Vinekar. He may be a small model of Anand Vinekar. No, I'm telling you, this is what is true. It is true. And then we, of course, Chandigarh is there, and the lion of Chandigarh, and the master of, the ROP ceremony is Professor Mangat Dogra, a very, honored gentleman and very sober, but yet very effective and has a killing, instinct. So that is what Professor Mangat Dogra is there. And with his, organization, with his, host, we had a very good meeting there. And then, of course, Dubai was no man's land because we are not there. So I took the mental to organize it there, and I did it. And then next meeting was in Surat. She is sitting here and smiling. And she did a wonderful job in Surat. And of course, Anand was after her to do it better. And the next meeting we are having in Chennai. And what is the date? Huh? July 12th, 13th. I'm sorry. I should know, and I'm asking you. But anyway, so 12th, 13th is the meeting there in Chennai, and it is with the Shankar Nethralaya. Shankar Nethralaya meeting is also in pediatric ophthalmology. ROP only. So ROP is there, and ROP is here. So ROP there and here will make it very big. These are the awards. There are 2 awards we give every year. Professor Rajvardhan, sorry, my name. And these are awardees, one from Taiwan, then China, this Michael Sapiro, and Bangladesh, and now the next one will be from Japan, and that will be in China. We keep on doing some research, and we do some publications. A lot of those have gone. I don't want to go into the details because if you all can see there. Thank you very much. And my time is up for a very long time. They are showing me time is up. So time is up. Thank you very much.
Thank you very much, sir, for showing us the entire journey, not only yours, but of ROP in this country, and how, especially with your effort, so many things, and it became now today ROP society, which you can't imagine. That retro rental fibromalacia, one para used to be there, and that is where you